Hello, I'd like to welcome you to our office. My name is Dr. Demetrios Kydonieus. I'm a chiropractic nutritionist. That means I have degrees in chiropractic and nutrition and a lot of advanced training. Been doing this since 1988, so I've got a lot of years of experience. I've helped thousands of people over that time, and now I look forward to helping you. What exactly do we do in this office? What is wellness care or holistic care? Holistic care is more than just chiropractic, it's more than just nutrition, it's more than physical therapy, it's more than exercise training and rehab, okay? Lifestyle training, whatever you want to call it. Holistic care is under the usually in modern terms or current kind of fad terms is natural care, right? So natural care means that we're not going to use drugs or surgery. Everything we do, including the supplements and even the herbal medicine, is basically something that works with your body. It does not force your body to do something like a drug or a medicine does. Okay? Our goal here is to unlock the healing power that's inside each and every one of you watching this video right now. So what we want to do is we want to figure out through an intense examination procedure, which you're about to go through. We're going to talk about nerve testing. We're going to talk about heart rate variability or physiological testing. We're going to do classic chiropractic and orthopedic testing, and we're going to go do other neurological tests. So we're going to have some computer-assisted, really high-tech things, and we're going to have some old-fashioned doctoring, orthopedic and chiropractic testing maneuvers that basically have worked for, literally over 100 years. And so they work, so we keep doing them. All the equipment that you're going to go through in this room today is basically here to test the part of your body that you cannot feel consciously. So right now you're telling me about a problem of some kind. You've told me your back hurts, you told me you have a stomach ache, you've told me you have restless leg syndrome, you have digestive issues, you have allergies, whatever it is that your symptom that brought you here, we're going to use this testing to kind of home in exactly on what it is you need to get well. And that and the result is going to be, we're going to sit back in this room again tomorrow most likely, or the soonest day that you can get back here after your exam, and we're going to go over the results. I'm going to tell you what I found, what it means, what I can do, what I can't do, what I expect to happen, and how long and how much, of course, it's going to cost to do all this to get you well. Your care plan is going to have multi-pronged approach, if you will. A lot of you are now sitting there going, well, I came here for chiropractic. I came here for nutrition. I came here because I heard he's a really good doctor, and I want to see what he can do for me, because all the other doctors have let me down and have not been able to help me. The current drugs I'm on, the prescription medicines, are not helping me. I'm stuck, or my lifestyle's stuck. I've tried other chiropractors, other nutritionists, and I just can't get well. The vitamins didn't really do it, or the diet I was on didn't work, or the chiropractor I was seeing, it only lasted for a couple days, and then all of a sudden my pain came back. All those are the most common complaints that I get when patients seek my services out. I tend to get the patients here that don't get well in other doctors' offices. It's just what I've attracted. So like I said, and how do I get you well? My approach is going to be through chiropractic, going to be partially through nutrition. We're going to probably have some physical therapy added in there, and we're going to have lifestyle and exercise instruction and management added in there. I'm really going to be more like a lifestyle coach, a holistic wellness coach. So my job is to use a little bit of all those techniques to get your physiology and your nervous system functioning correctly so that you can get well and not have the problems that you've been having. Obviously, what you've done up to this point hasn't really worked, or you wouldn't be here. So my approach is different, but it is multifaceted. You will get, like I said, you will not just get adjusted. You will get adjusted and get some nutrition. You will not just get nutrition. You'll get nutrition, and I'm going to talk about chiropractic. Now, if you already have another chiropractor and you're here for nutrition, that's fine. Then I can give your chiropractor my insights, and they can do the chiropractic. I can do the nutrition. If you are here for chiropractic because you already do your own nutrition thing, or you actually have an herbalist or a Chinese medicine person or a nutritionist working with you, then that's fine. You don't have to do nutrition through me. I'm still going to give you advice on nutrition when I see things that aren't getting corrected. So just be aware that your approach is going to be a really big, all-encompassing, holistic or wellness approach, not just a really focused adjusting only, or nutrition or vitamin pills only, or diet instruction, or physical therapy and exercise and sports rehab only. So with that being said, watch this next video. I look forward to seeing you in a few minutes and getting started. So this is Dr. D, and I'll see you soon. Bye-bye.
Hi, I'm Dr. Alicia Armitstead. I'm a chiropractor. I specialize in a technique called nutrition response testing, and I've been practicing in New York City for almost 10 years now. And new patients, when they come in wanting nutrition response testing, don't know exactly what to expect because it uses muscle testing, also known as applied kinesiology. So I put together this video to explain a little more about what to expect on the first visit. So I'm going to muscle test, so go ahead and bring your arm up. I use any muscle in the body, just easiest to use your arm closest to me. What's going to happen is I'm going to push and you're not going to allow me to. So you're going to resist, match my pressure though, okay? Don't overpower. So I'm going to push, match my pressure. Good. And so if you press too hard or too soft, I'll let you know. What happens is I'll put pressure on the stomach, on the liver, on the adrenal glands. I'll test all the organs today. And as I put pressure on the body, let's say the liver, if there's something going on here with the liver, the body won't like the pressure. Sends a signal up to the brain, wants to protect the liver. I push here and I push here, and the arm will give a little bit, okay? And now if it gives, I know, okay, something's going on with the liver, and that's because the body wants to protect the liver. It doesn't care about the arm, okay? And now the question is, why did it go weak? Does it just need some type of liver enzymes you're not getting in your diet, or is there an actual toxin? So to figure out what toxins are bothering it, keep your arm up. We use homeopathic test kits, okay, and they're in glass, and the body can actually pick up on the energy through the glass. I just lay it on the body, I go back to that liver and I push, and now let's pretend it goes strong. That change in muscle testing is because one of these is actually resonating with what's going on in your liver. So then we'll go one by one and we'll actually figure out what it is. And so if we're going to help the liver with the toxin, and let's say that one of these 3 supplements could help, instead of guessing, well, take this, let's see what happens, we can actually muscle test and figure out which one will help. It's in glass, and the body can pick up on the energy through the glass. The majority of what I use comes from an organic farm called Standard Process, and it's food. The body knows what to do with food. So I lay it on the body, and I go and I put pressure on that liver, and let's say now it stays weak, okay? So the body doesn't care for this. And if I take a different one and I lay that on the body and I push nice and strong, then I know, okay, this is what the liver needs. So in that way, I'm designing a nutrition program just for you.